Thank you for the opportunity to present today. This work was supported by a grant from the Department of Defense. Our only disclosure is that Dr. Coleman developed the cannulas used in our fat grafting procedures. However, this will not impact the content of this presentation. Craniofacial disfigurement can cause significant psychological distress and functional impairment. Traditional reconstructive options such as implants or flaps are often invasive, complex, and carry significant risk of complications. Fat grafting, on the other hand, is minimally invasive with an excellent safety profile, and as such has catalyzed a paradigm shift in the way many deformities are treated, not just in the face, but throughout the body. With nothing but autologous fat, we can take defects like this and achieve results like this. However, fat grafting remains limited by variable and often unpredictable volume retention, which can be particularly problematic in the face where precision matters. And despite nearly 3 decades of research, we're still searching for the best practices in most steps of the process. Right now, the 2 processing techniques we see used most commonly for small volume fat grafting are Telfa rolling and centrifugation. There have been 5 animal studies to date comparing these processes, and the results have been mixed. One of the 2 studies in favor of Telfa was actually from our lab, so I have to admit that at the outset of this experiment, our hypothesis was that Telfa rolling would be less traumatic to the graft and ultimately enhance retention. However, this is not what we found. This was an IRB-approved prospective controlled clinical trial in patients with stable traumatic or post-surgical craniofacial volume defects at least 3 months out from injury. We excluded anyone with persistent open wounds or with recipient sites that communicated with the oral cavity or sinuses. Fat was harvested manually in 10 cc syringes and either processed by standard Coleman technique or rolled on Telfa for 3 minutes. It was injected into the target site in small aliquots using 1 cc syringes with a 14-gauge Coleman injection cannula, utilizing numerous passes to maximize even distribution. A portion of the fat was also used for stromal vascular fraction isolation and flow cytometry to determine progenitor cell subpopulations. Patients were followed with formal assessments at 3-month intervals for 9 months. CT scans were performed at each time point and graft volume was quantified by an experienced head and neck radiologist who was blinded to the intervention. Contour improvement was also assessed visually by a physician using the standardized spatial volume assessment scale. Patient-reported quality of life outcomes were collected using several well-validated metrics. Demographics were similar between groups with an average age of 40 and BMI of 27.5. 10% had diabetes and about 1/4 were active tobacco users. We grafted an average volume of 24 cc's per subject, and all defects were post-traumatic or iatrogenic, most commonly in the temporal fossa after craniotomy. Demographic variables were not significantly different between groups. Age, BMI, and gender also had no correlation with retention in either cohort. Both groups have long-lasting volume augmentation, which stabilized by 3 months at around 65% retention. However, there was no significant difference between groups in CT measured volume retention at any time point. The facial volume assessment scale showed significant improvement in contour in both groups, with results also stabilizing at 3 months. Nearly all patients treated had significant improvement, and 14% achieved an appearance similar to their uninjured side. This was with a single round of fat grafting, which is pretty incredible. Interestingly, flow cytometry revealed significantly more ASCs in SVF isolates from centrifuged grafts. However, there were no differences between groups with regard to overall SVF viability. With no major adverse events and successful long-term volume retention, this study reaffirms our prior findings. Fat grafting is a safe and effective option for treating craniofacial contour deformities. This is the first prospective human trial to directly compare Telfa processing to centrifugation. We found no significant difference in objective or subjective measures of volume retention, suggesting that either technique can be a good option. Interestingly, in the centrifugation group, the proportion of ASCs in the SVF was higher. Whether or not this has implications for fat and applications with primarily regenerative rather than volume goals remains unknown and is an important question for future investigation. Thank you very much for your attention. My contact info is listed if you'd like to contact me with any questions.